Thank you for joining us today for our weekly COVID-19 briefing. Today I'm joined by Dr. Mike Mendoza, the Monroe County Public Health Commissioner. It's just the two of us today. I want to remind everyone watching that we have a Spanish language simulcast available on the Monroe County Communications YouTube channel. It's easy to find. You just go to youtube.com and search Monroe County Communications. And as always, I want to thank our American Sign Language interpreters from Sign Language Connection for providing ASL interpretation service every week. So let's start off this week, as we usually do, by going through some of the metrics and data that's being reported by the Public Health Department. Our positivity rate does continue to stay below 2%, and we're seeing a plateau or even though a slight uptick in new daily cases over the last week. Earlier in the week, we were over 200 new daily cases, and yesterday we were at 175. So those are elevated numbers compared to what we were experiencing over the last several weeks. In addition, yesterday's 7-day average of new positive cases is up to 144. When we spoke last week at our briefing, the data point was 115. As I said before, our 7-day positivity rate is still below 2%. It's at 1.8%, but compared to last week, we were at 1.5% on this day last week. Fortunately, hospitalizations, though, and ICU numbers continue to decline. With yesterday's report at 128 in the hospital and 28 in the ICU, those are down from 139 residents hospitalized and 39 in the ICU in the Finger Lakes region. So again, those numbers are heading in the right direction. We did notice as we look into where the majority of our cases are coming from, it does look like it's coming from younger residents, particularly those in their 20s, 30s, and some in their 40s and 50s. We have a bar graph, I believe we could put on the screen, of yesterday's new case breakdown. So this is what it looked like yesterday. As you can see, there were 32 people between the ages of 10 and 19, 28 in their 20s. Conversely, there's only 3 new positive cases for people in their 70s and 3 for people in their 80s. So again, we've done a great job in the community to work our way down from that second spike that we saw at the end of the fall and the beginning of the winter. With the warmer months coming, more outdoor activities are becoming available. So I want to encourage the community to continue to be smart, continue to wear your mask, and keep a good physical distance and keep those numbers as low as we can. I have a vaccine update as well. Obviously, more and more people in Monroe County and across the state continue to become eligible for the COVID-19 vaccine. As of this week, New York State's expanded eligibility to anyone 50 years of age and older. Our local vaccination clinics are fully supporting and implementing this change. The county's vaccine allocation for this week was over 4,200 doses, which will be administered through our clinics at the Rochester Riverside Convention Center and at the County Fleet Center. The appointments right now at the county-operated ones are fully booked, but you can still make an appointment for the future appointments at the state-operated Dome Arena location. Very easy to do. You can call the state hotline, 1-833-697-4829, or you can visit the Am I Eligible website through New York State, all of which is linked to on Monroe County's website, monroecounty.gov, and we also have our COVID hotline, 753-5555. Another good tool to check on vaccine appointment availability is the Finger Lakes Vaccine Hub's Vaccine Finder. It is simple, convenient, and it'll show you where available appointments are in our region. It's available at flvaccinehub.com. So it's www.flvaccinehub.com. So you can go to that website, and even though there's no appointments available at the county-run clinics for the rest of this week, that site surveys all the clinics, the pharmacies, and all the clinics in the county to see where the available appointments are and helps point you in that direction to make your appointment. I also want to remind residents again this week, if you have made multiple appointments or are unable to make your appointment, we ask you to please contact the organization that you have the appointment with to cancel your appointment. If you have appointments that you don't go to and you're holding appointments, it's keeping somebody else in this community from making that appointment and getting this life-saving vaccine for themselves. So we're asking everyone to please be a good neighbor, but also to be conscious of protecting, keeping other people safe, and getting vaccine in as many arms as possible by being conscientious to cancel appointments that you're not going to go to. Most sites, it's very simple to do. The county, again, we have the phone number on the confirmation that's sent to you. The hospital system said the same thing, so does the Dome. So it's very easy to cancel an appointment once you've made one. According to the state vaccine dashboard, 115,000, just over 115,000 state vaccine, Monroe County residents have completed their vaccine series as of today. Last week's briefing, 101,000 had completed their series, so we're making progress there. In addition, 233,000, or 31.4% of Monroe County residents have received at least their first dose of vaccine, again, compared to last week where we were at 202,000, or 27.3%. So we're making a lot of progress in vaccinating residents. Remember, when we talk about percent of residents vaccinated, we're talking about the denominator used is all residents in Monroe County, including children who we know are not eligible for the vaccine yet. So the number of eligible people who've received the vaccine is obviously higher than that. So this is encouraging news, and every week it continues to go up by a greater number. So before I turn over to Dr. Mendoza, I also do want to take a minute to address school guidance and regulations. I know that this issue is on the minds for a lot of families and children in our community, and I also understand that there's some confusion as it relates to the guidance. I think there's no question that schools provide a lot of services to our children and families, and I don't think anybody disagrees that kids are better off in school when it's safely to do so. Last Friday, the CDC updated their guidance on distancing in schools to reduce the distance from 6 feet to 3 feet in certain circumstances without barriers, but maintain proper masking and other safety protocols. Dr. Mendoza and I subsequently sent a letter to the state asking that they update their school guidance to reflect this change, which would help schools reopen to more students here in Monroe County. We support reopening our schools and know that it's important for children to get to a return to normalcy, in-person schooling, and the ability to see their friends again. And while we support schools reopening, we don't have any actual authority or guidance to make this happen. Schools are regulated by the state of New York, and they report to the state of New York, not to Monroe County. Monroe County does not have any orders or regulations in place right now that prevent schools from opening. There has been confusion around this issue, but it's pretty clear. Under the state guidance now, schools can be open with 6 feet physical distance without a barrier, or 3 feet with a barrier. We've asked the state to bring their guidance in line with the CDC to allow them to go below 6 feet in certain circumstances. Dr. Mendoza and I have been supportive of our schools from the start of this pandemic, and we will continue to support them in any way that we can. If that means helping them purchase and secure barriers or any other equipment, allocating more rapid testing kits, we will do that. But unfortunately, we just don't control schools fully reopening, but we will continue to advocate that the state move to make that happen. So with that, I'm happy to turn it over to Dr. Mendoza.
Thank you, County Executive Bello. I just wanted to add a few comments to the numbers. What County Executive shared is still good news, but I do think that we need to maintain our vigilance. Looking back over the last week, we mentioned that the positivity rate has clicked upward from 1.5% to 1.8%. By every measure, still low, less than 2%. This is still very good. But we also have, heading in somewhat of the wrong direction, the number of new cases as a 7-day average. Daily cases 115 last week, up to 144 this week. Now that is in part due to more testing, but the positivity rate has also gone up. So this leads me to conclude that there is a slightly higher burden of COVID-19 in our community. Again, still low, but I do think that we need to follow this very closely. I do not think that the variants are the reason for this, the primary reason for this. We know that the variants have been here since January or earlier, and we have seen our numbers improve in that time. So while I think it's still premature to conclude whether the variants have a role in this or not, I don't think that the variants are playing a major role in this. I do think the primary driver for this increase is that it's springtime. People are going out more, people are enjoying company again, like we used to, like we want to. I do think that there are more indoor gatherings, and we are seeing this through our contact tracing, particularly among the younger individuals, younger than 30. We're seeing more gatherings, either sports related or simply social gatherings. And I want to remind everybody that unless everybody in your party is fully vaccinated, which is quite rare in the under 30 crowd and not even likely in the under 16 crowd, we want to remind you to make sure you wear your masks and to be thoughtful, just like we were last fall when our numbers were still relatively low. To give you a sense of the breakdown, this shows the impact of the vaccine and what we're seeing as somewhat of a trend. When you look back at the week of December 15th, of our percentage of all COVID cases in that week, 26% of them were age 60 and older, and 9% of them were age 5 to 17. Fast forward to the most recent week, the week of March 16th, the percentage of COVID cases 60 and older is down to 14%. So from 26% to 14% in that 60 and older age group. This is a sign of the vaccine. When you look at the 5 to 17-year-old age group, looking from the week of December 15th to the week of March 16th, that number has doubled from 9% to 18%. I think the increase in that younger demographic is, like I said, not related to school activities, not related to educational activities in the schools, and really not related to sports, competition on the field or on the court or on the ice. I think this is all a reflection of those social gatherings off the field, out of school, in our backyards, and more likely in our living rooms and in our homes. So I want to reiterate, as we look ahead to trying to reopen the schools, we still have a responsibility to our students and to our community to try to do everything we can as the vaccine ramps up to make sure that these numbers stay where they are. Finally, I want to close with some more recent data on the vaccination rates in our schools. You'll recall 2 weeks ago now, we were asking all of the school districts to report to the health department the percentage of staff and teachers who are completely vaccinated. So this number is going to be relatively low because a number of the teachers have gotten their first dose but are waiting for their second dose. But in private schools, the percent of teachers who are fully vaccinated is already up to 32%. And among staff, it's 28%. In public schools, the numbers are even better. Among teachers, 43% are fully vaccinated, and among staff, 22%. And like I said, this is still relatively early because many of our teachers have gotten their first shot and not their second, so they won't be reported in these numbers. But I do anticipate these numbers improving greatly in the coming weeks. And I think this is all really good from the standpoint of keeping our schools and our teachers safe. So with that, I will pause and hand it back over to the County Executive.
Okay, I think we will open up for questions now. Raquel Stephen from WXXI, you're first. Raquel, you're on mute. Okay, we're going to move on to Jennifer Lukey from WHEC.
Good afternoon, everyone. County Executive Bello, my first question is for you. I'm wondering if you would like to comment on the situation and story with the governor about him giving priority access to his family members to COVID-19 testing. At that same time, here in Monroe County, we saw very limited supplies of testing materials. Those folks who were tested were mostly hospitalized at that point. What's your take on the situation?
Well, if these reports are true, what happened here is wrong. Using government resources like that for your personal gain, I think is wrong and is completely inappropriate.
Thank you. And Dr. Mendoza, next question is for you. Obviously, we know there's been a lot of talk about schools. The CDC, you and County Executive Bello said that you have asked the state for guidance. I have been harassing them as well every day, checking on when that update may come. But there does seem to be a lot of talk about transmission rates and how those will play into these different zones. I wonder if you're concerned that 1 week we might be in a blue zone, 1 week we might be in a red zone, 1 week we might be okay. I mean, how are you going to guide schools, I guess, through this, even if we just stick with the CDC metrics week to week?
So I thought ahead about this because this was a question that came up even before the CDC guidance came out. When I was just looking at some of the papers that were published, it was very clear that the community transmission rate would have to play some role in the level of mitigation strategies that we would need. And so as I see it, we want to give people a chance to open and stay open. So if the state guidance changes and permits the use of the CDC guidelines or some variant of it, we want to be able to give schools a chance once they've opened to stay open. So one way to mitigate that issue is to offer testing. We know that when we did testing in the schools, the rates were exceedingly low. And so if we can, again, show that while there may be increased rates in the community, but it's not finding its way into schools, then I think that we ought to have a way to keep the schools open. So I think testing is one way to accomplish that. The other would be contact tracing. When numbers are low, like they are now, contact tracing is very informative. And if we can trace cases such that they have nothing to do with the K through 12 environment, then we certainly don't want to penalize the schools for a problem that doesn't actually exist in the school. So I think there are ways to do this, but it all hinges upon our ability to have guidance that we can act upon. Right now, the guidance hasn't been changed since August of last year. And I think this is crippling our schools. So I am hopeful, and I would love to see a chance for our schools to reopen, but unfortunately we have to wait just like everybody else.
Thank you, Jennifer. Next is Brian Sharp from the Democrat and Chronicle.
Thank you. I was just wanting to go back to the vaccination rates for schools, private versus public, and was just wondering if there's any insight as to why the lower rate of vaccination for teachers in private school and just the difference that we see in those numbers, staff as well.
Well, I could dig into the numbers a little bit, and I probably will. The numbers, the total denominator in private schools is much, much smaller than in public schools. So when you have a smaller denominator like that, small variations will translate into large perceived differences in percentages. But I think it probably falls down to, the differences in demographics between people who have chosen public school versus private school. The teachers in private settings are lower than their public school counterparts, but interestingly, the staff in private settings are higher than their public school counterparts. So, I think it's premature to try to draw any conclusions on that, but I think it would be interesting to dig into that a little bit more once we have more data.
Hey, and I was just wondering as far as vaccinations go, I know we've seen an increase over recent weeks, higher than we'd seen in previous weeks, but are you seeing any more, I don't know if elasticity is the right word, but just that appointments aren't booking up as much? I know earlier this week you were saying we've got a lot of open appointments at the convention center. Now you can actually get an appointment seemingly fairly easily at the Dome. I didn't know if that was slowing down and if there was any concern.
I think people are not gobbling up the appointments as quickly as they were, but all the appointments are getting taken. I looked this morning when I was seeing patients trying to find an appointment for my patient in front of me, and I couldn't find an appointment for her. So, I think the demand is there. It's just not peaking all on the same days because we have so many options in the community. So I think the demand is still there, and certainly once we start seeing appointments going unfilled, I will raise red flags to try to expand the eligibility. But I think right now the demand is there. It just looks a little different.
Thank you, Brian. Do we have anyone on from 13 WHAM?
Hi, yes, it's Jane Chaco.
Hi, Jane.
Hi, so a question about the school confusion. If the guidance doesn't change, Dr. Mendoza, does your support of the barriers change at all? Like, would that be a recommendation for schools? Is that a possibility to implement that so the 3 feet could happen?
Well, the barriers are permitted under the existing guidance. So if schools wish to do that, they could go the route of installing barriers. The reality is the CDC guidelines and most of the evidence show that the barriers don't seem to have much of a role. But if that is the ticket to reopening, that is certainly within the school's prerogative.
Okay. And for the county executive, what is the communication with the other counties and what they are doing in regards to schools? I know some counties have been able to reopen fully, so I just wanted to hear more about that.
No, to be clear, there are not different rules for different counties. The schools are all operating under guidance that's set by New York State. What some other counties have done, we've seen media reports, is they pointed to, one of the counties actually pointed right back to state guidance in their announcement, and others have policy proposals that they put out there to reopen, but they're just proposals. It doesn't change what the state guidance is, and the schools that are reopening in those communities are still submitting their plans to New York State and reopening under the state guidance. It's, you know, Dr. Mendoza and I submitted our policy proposal to New York State last Friday when we asked New York State to update its guidance as it relates and match the CDC guidance. So that's what it is. But to be very clear, there are not different rules in different counties for how schools are able to reopen.
Have you heard back from the state?
No, we have not heard back to date.
Thank you, Jane. Next up, we have Atia Collins from WROC, and this will be the final questions.
Good afternoon. Atia Collins here, Channel 8. I will get away from schools and ask you both to talk about the decision to approve the Lilac Festival and kind of what this means going forward with the summer for other festivals. Does this set a precedent? Is this what we can expect?
Yeah, is that for both of us? Yeah. So, listen, I think, you know, as the numbers continue to head in the right direction, and we have more and more people in our community are vaccinated and protected, the studies have shown the numbers are going down. The vaccine works. If we go back to our experience last year in the summer, outdoor activities have proven themselves to be a lot safer than indoor activities. And there is a lot of pent-up demand, I think, and an excitement to get back to some level of normalcy, to be able to go back to do things that we used to be able to do. And I think that that is important to then be able to look at those outdoor activities, particularly the outdoor activities like the Lilac Festival, parades and other festivals that are going to come up this summer, and find ways that we can do them and do them safely, understanding the science, right? And so I think that what the Lilac Festival is proposing to do meets the state guidance. I think that it recognizes that outdoor events are safer than indoor events, and we're in a different place in this community today than we were back in November and December. So I'm looking forward to this summer. I really am. I think that we're heading in the right direction. We still need to be cautious. We still need to wear our masks. We need to follow the guidance that we've been given, that and the things that we know that work. We need to get our population vaccinated as quickly as possible. But I'm looking forward to this summer, and I'm looking forward to getting back to that sense of normalcy and also back to the sense of community, where we can come back together again. I think we miss being around each other. I think we miss those activities that we used to do that give us that sense of community and togetherness. So I'm really looking forward to what this summer might bring.
I'll simply add that we have learned so much in the last year, and particularly the value of being outdoors with the environment and air circulation outdoors so much more effective than indoors, and the value of masks. And I think from when I actually looked at the Lilac Festival plans, the easiest part was the public health part. You know, the plans were written very well to do everything possible to keep all of the patrons and our members of our community safe and healthy. I think the hardest part was trying to figure out whether a certain event was classified as a restaurant or a gathering. And that was more logistics and trying to figure out how to make things work within the guidelines. But from a health standpoint, you know, most of it was just a no-brainer. And I think the organizers, you know, went the extra mile to put in detail, you know, to keep us all safe. And I'm looking forward to it just like everybody else is. So I think this bodes well, provided that the rates continue to stay low and continue to go down and the vaccination rates go up. I'm very hopeful that we'll have a relatively normal summer.
And then just one more question for the county executive. With the talk about medical marijuana or legalization of marijuana making headlines just yesterday and today, what are your thoughts about how this will impact the economy here, and what do you see as far as successes and challenges with that here in Monroe County?
Well, I haven't seen the actual detail, the revenue breakdown of what will happen with the sales tax that's applied to it, and so the economic activity is hard for me to opine on. But you know, the one challenge I think that remains that's always really remained when it comes to this issue is is making sure that we have the right tools in place to be able to handle what does it look like when someone is driving while impaired, and what resources do law enforcement, our sheriff's department, our troopers have to make sure to retool, because right now they're clearly prepared to be able to look at driving while intoxicated with alcohol. But how do we test, and how do we help identify people who are driving while impaired marijuana? So I think that's one of the challenges that we're going to have to work through while we're in this time period between when the legislature acts and when the law takes effect.
Okay, that does it. Thank you, everyone.
Thanks, everybody.
Have a great day.
Have a good day.